I'm librarian Paul Sevilla at the Livermore Public Library and your host for tonight's Q&A program on the COVID-19 vaccines. Attendees are muted and not seen. If you have a question, please type them in the chat box. I will be moderating tonight's Q&A and monitoring the chat. I would like to thank Access Community Health for arranging this program for the community. Access Community Health provides quality, affordable medical, mental health, and substance abuse services that promote the well-being of all members of the community. A nonprofit organization founded in 1972, Access Community Health provides services from 5 sites in the Tri-Valley area and serves more than 14,000 members of the community. Currently, Access holds their vaccination clinic out at the Civic Center Library's community rooms. And it's on Tuesdays and Thursdays from 10 a.m. to 5 p.m. And they are available for walk-ins. The public will be able to get free vaccinations courtesy of Access Community Health. And now let me introduce our experts this evening. Dr. Dawnell Moody is Access Community Health's Chief Medical Officer. Dr. Moody is a board-certified pediatrician with a master's in public health. At Access, she provides care for Access's youngest patients and oversees the medical staff. Helping parents understand how vaccines work and their efficacy is an ongoing focus of her work, and she is versed in the latest information about the COVID-19 vaccines currently approved for use in the United States. Welcome, Dr. Moody.
Thank you so much, Paul. Thank you for inviting me.
Our next guest is Dr. Thomas Addison, pulmonologist and critical care physician who has worked at Kaiser Permanente and at UCSF Zion as the Director of Critical Care Units. He holds a faculty position at UCSF School of Medicine and is currently volunteering at COVID vaccine sites. Welcome, Dr. Addison.
Thank you, Paul.
All right, so we'll begin with some general questions common questions that people have asked us about the vaccines, and we'll just begin. Dr. Moody, is there a question that you want to address first, or?
Yeah, so the most recent age group to get approved for vaccination with the Pfizer vaccine was 12 years and up. And I know parents have a lot of concerns and questions about vaccinating children. Is it needed? Is it safe? So the CDC says that everyone in the country 12 and up should get vaccinated. Although most children don't get sick with COVID very seriously, they might have mild symptoms. It's not all children that only have mild symptoms. There have been about 15,000 children who needed hospitalization because of COVID since March of last year. And unfortunately, there have been a few hundred deaths in children associated with COVID, especially with the multi-inflammatory syndrome in children. So while the risk is low in children if they get COVID, it's unfortunately not zero. But the part that's most important about vaccinating 12 and up right now is just stopping the spread of COVID. We've seen in California how fast the case numbers have been dropping since our vaccine campaign really picked up over the end of the winter and spring. So we know these vaccines work, but we're not there yet in terms of stopping COVID in its tracks. And if we get the youngest in our population vaccinated, and right now that's 12 and up that are approved to get Pfizer, we can give COVID really no safe harbor to go to. The more that COVID gets passed around, the more chance it gets to mutate. That's kind of in its nature. It just changes itself every few times it gets passed around. And that gives us opportunities to try to find tricks, find new ways to get spread. So that is part of the reason that the CDC wants as many people as possible to get vaccinated, so we can bring down those rates even further and stop the spread.
Okay, and reminder to the attendees, if you have a question, please type them in the chat box. And all right, so there is a question here from WW. If let's see, if fully vaccinated and you get COVID-19, does it replicate and cause tissue damage?
That's a really interesting question. I might let Dr. Addison take the first.
Yeah, what I've read about this, and I'm not an expert. I'm not a scientist. I'm a consumer of science, and I've basically tried to keep up as much as I could on COVID because I found it extremely interesting. Plus, I'm in a higher risk group, being a retired physician. But I think what we know basically is if you're vaccinated and you get COVID, generally you don't get as ill as if you're not vaccinated. Can it actually get into your system and make you sick? Yes. And people have died in spite of vaccinations, but it's extremely rare. In May, there were 850,000 people in the United States admitted to the hospitals with COVID, and only 1,000 of those people were vaccinated. So it's an extremely effective vaccine in preventing clinical illness. And I think that's basically what you need to know.
Yeah, and I would say for people who have had COVID and recovered and get vaccinated, so with the natural COVID infection, immunity, we're not 100% sure how long it lasts. And if you had what is known as kind of the wild type, the initial COVID virus, your immune system may not be as familiar with some of the newer variants going around, so it's possible to get reinfected. So it is a good idea for people who have had COVID to still get vaccinated so that they can have even longer lasting immunity. And there was an article published in Nature actually just today. They biopsied parts of the lymph nodes that were close to the arm where people got vaccinated. So people volunteered to have a little piece of their lymph node looked at and see if the cells in their lymph nodes remembered the vaccine, how to produce antibodies, how to make a response against COVID. And they did at least 4 months out. So what it's looking like, at least where we stand right now, is that the immunity is reasonably long lasting with this vaccine, especially the mRNA vaccines. And just to give some history on mRNA, this concept has been around for 20 years. So this is not a new science by any means. Scientists have been looking at mRNA as a possible vehicle for infectious disease vaccines, but there was never kind of that impetus, that real motivation to apply it towards it until the COVID-19 pandemic. Now, there have been some companies, Moderna specifically, also BioNTech in Germany, have used mRNA to personalize vaccines to treat people for cancer. And this was a decade ago, even more. So there are people walking around in the world who have been treated with mRNA vaccines that were tailored to cure their cancer. It's a very similar concept to teach your body to fight COVID. So this is by no means an experimental thing. This is something that actually has decades of science behind it. And it's very exciting because it turns out it is producing a very effective vaccine. Some of our vaccines aren't nearly this effective, like the flu vaccine, right? That kind of fluctuates from year to year in its efficacy. It's still the best tool we have against flu, but these new mRNA vaccines really are the best tool that we have to stop COVID.
And another, and I think a common question that we get, and I think this is related to a question that was just posted. Is it safe for children to get a COVID-19 vaccine? And even though, and Yeah, is it safe for children to get a COVID-19 vaccine?
Yeah, so the body that governs decisions around vaccinations in the United States, it's called the ACIP. It's the subdivision of the CDC that is full of renowned experts from around the country, pediatricians, immunologists, vaccinologists, infectious disease experts, people who really know their stuff. Some of the most brilliant minds in the country around infectious disease and vaccines. They're the ones who sit on this panel. They look at the data, and no shortcuts were taken in producing these vaccines other than moving up the actual production before they were approved. It was kind of hedging their bets so that it could be available earlier, but no shortcuts were taken in the testing and the safety data. So the ACIP looked at the safety data for the vaccine, first 18 and up, for Pfizer was 16 and up, and now for 12 to 15. And what they found, and it was a nice robust study in the 12 to 15-year-olds, was that that age group didn't have a higher incidence of side effects with the Pfizer vaccine, and they actually had a higher efficacy rate, because teenagers tend to have these immune systems that are kind of rearing and revved up to go and ready to learn vaccines. So the Pfizer vaccine was very efficacious in the 12 to 15. Now, there have been some reported cases of pericarditis and myocarditis, and I think it's important to acknowledge that there have been reported cases, about 450 to 500 now. Pericarditis and myocarditis is something that we see in pediatrics more commonly than you might think. The majority of them are caused by viruses, Coxsackie virus or parvovirus, or some things that just might look like a common cold or flu in someone else. And it can actually cause some inflammation of the heart. So what they've seen in these cases reported so far, the majority of them are in males under 30, and they're all very mild cases. They're often treated outpatient. Some of them have been in the hospital for supportive care, but they're treated with NSAIDs and they recover, and there's no long-term adverse outcomes. In other words, their heart isn't affected, and their heart doesn't lose its capacity to do what it needs to do either during the course of it. So what the ACIP has done after looking at these cases is decided that the benefits of vaccinating this group still far outweighs the risks. So it is a safe vaccine. In fact, I have a 7 and a 9-year-old daughter, and I know that the vaccine studies are being done in younger children. And when the data is published, when it's ready to go, I'll vaccinate my daughters as well.
Thank you. And this is just a reminder to the attendees to just use, if you could just use a chat to ask short and concise questions, and just to limit it to 1 or 2 short questions. There are some things that we really can't address tonight. We're really here to answer. Our experts are here just to answer, questions. So if you could just limit it to that, that'd be great. I know William, Miss William Price, you have your hand. Yeah, you have your hand raised. So if you have a question, please type it in the chat, and that's how we'll respond to it. So go ahead and type your question in the chat. Okay, well, we can move on. Let's see. There is a question here from another question here from WW. Out of 21 incorporated and unincorporated cities in Alameda County, Livermore is 18 out of 21 in vaccination rate. That's not good. What is Livermore doing to get more people vaccinated?
Yeah, so thank you. That is a very good question. And Access has been working with Alameda County Public Health Department to look at not only opportunities for access to get out in the community and vaccinate more, but also for pop-up sites in conjunction with Alameda County Department of Public Health. So at Access, we've started vaccinating 2 days a week out of the library, as you mentioned, the Civic Center Library. We're there from 10 to 5 with a little lunch break between 12 and 1 on Tuesdays and Thursdays, but anyone can drop by and get vaccinated. We don't care about immigration status. If you have insurance, it's free. We'll take good care of you, get you set up with a Pfizer vaccine. And anyone can come and get vaccinated Tuesdays or Thursdays at the library. We also have a vaccine site in Pleasanton on Fridays, and we've been reaching out to work with the schools. In fact, we had a vaccine event in conjunction with the Livermore Joint Unified School District at Vineyard High School, where we invited all of the seniors in May to get vaccinated before graduation. So we're trying to find opportunities to get out into the community, especially people who might be hesitant or have questions, or some occupations where the vaccine rate's a little lower. We've been working with some of the labor groups to see if we can get out and have vaccine Q&As kind of like this and bring vaccine with us, so that if anyone is ready to get vaccinated at that moment, we can go ahead and give it to them.
Okay. And yeah, Mr. Price, I'm sorry that again, attendees can only type their question because of the way this program is formatted. So if you can try to type a question, please do that. Just do your best to type your question in the chat. So another question that people typically have is, do I need to wear a mask and avoid close contact with others if I am fully vaccinated?
Yeah, so that's a really hot topic right now, an interesting question. The California Department of Public Health recently adopted the CDC's guidelines, which says that if you're fully vaccinated, it's optional to wear a mask in indoor settings where you're mixing with other people or going into retail stores. They gave stores the option of whether they want everyone to wear a mask or just allow those who are fully vaccinated to not wear a mask. So at this point, if you're fully vaccinated, it is up to you if you want to wear a mask or not. Now, some of you may have seen some headlines recently about the World Health Organization, the WHO, recommending that those who are fully vaccinated still mask indoors. While that's not official policy of the CDC and the CDPH, I think that everyone should kind of make their own decision about what your risk level is. Do you have underlying conditions? Who do you live with? Does anyone you live with have a compromised immune system, receiving chemotherapy? That might make you want to wear a mask indoors more, or keep dining outside rather than inside when you go out. So I think each person has to kind of look at their own risk and who's around them, and make the best decision for them and their loved ones. And Dr. Addison, do you have anything to add to that?
Oh, I think that's true. I think obviously it's clear that this vaccine is very efficient for healthy people. It's going to protect most healthy people very, very nicely. If, on the other hand, you are taking immune suppressant drugs for rheumatoid arthritis or for even for asthma, there are more and more drugs now available for that affect your immune system, and and some of these really inhibit your ability to respond to vaccines. So I think anybody, for instance, who's getting Rituxan for autoimmune disease has to be very careful, because you're not going to have the immune protection that a healthy individual is going to have. On the other hand, if you're otherwise healthy, generally outdoors is very, very safe as far as I can tell, and indoors probably safe unless you're concerned, like Dr. Moody said, taking it home to somebody who's also at risk and that sort of thing. Maybe that would be good to wear a mask. But I think you're going to probably, the vaccines have been just so effective overall. I saw some data about Los Angeles County had 12,000 COVID deaths between December and June. Only 0.2% were in vaccinated people. 99.8% of the deaths occurred in people without vaccinations. So the vaccine is very effective.
Again, just a reminder to use the chat to please just ask a question for our experts, for our panelists tonight. And there is a question from Rich here, which is the best vaccine? I know there's a few to choose from.
Yeah, so the easiest answer is the one that's available to you. The one right in front of you is the best vaccine. But if you look at the three different vaccines, the mRNA vaccines, Moderna and Pfizer, they're both really efficacious in terms of preventing COVID disease. So that's symptoms if you get data or if you get COVID. And we're also finding out that they're pretty good at preventing transmission between people. There's studies coming out of the places that vaccinated their higher number of population a little earlier than us, like Israel. And they did cut down on transmission between people as well. So that tells you that both of these vaccines are pretty efficacious. Now, Johnson & Johnson is great in certain situations, especially for people who may be unsheltered and homeless and just don't have an opportunity to come back for a second dose. For people with special needs who maybe have a hard time with needles, and anyone who's needle phobic, really. Johnson & Johnson has also been shown to prevent the majority of severe COVID and death compared to not being vaccinated at all. So Johnson & Johnson is still a good vaccine. The mRNA vaccines in real life seem to be a little more effective at preventing COVID symptoms and transmission than Johnson & Johnson, but I think if given a choice, whatever's in front of you is probably the right one. It depends on the situation you're in.
And I would just add that we're very fortunate in the United States because the three vaccines that have been approved are all very efficacious. If you compare them to the vaccines that are being used in a lot of other countries from China and from Russia, those vaccines aren't as good as the vaccines we're able to get here. So we're very fortunate to have the opportunity to get these vaccines. And again, not only access gives them for free, you get them anywhere for free. They're covered essentially by the federal government. If you have no insurance and walk into CVS, they'll give you the vaccine without charging you. And that's just the way that we're trying to overcome this pandemic, is try to get essentially what everybody calls herd immunity, where we get so many people vaccinated, this virus has nowhere to go.
And here's a question from Rachel. I'm not too familiar with the VA ERS reporting system. Are you familiar with that system?
Yes,
And
yes, absolutely.
how accurate is that system?
Yeah, so VAERS is as accurate as the information you put into it. So VAERS has been around for a very long time as a sort of data signal watching system for side effects, unexpected side effects, serious outcomes due to vaccines. VAERS stands for Vaccine Adverse Effect Reporting System. I myself have reported in VAERS a few times about things I've seen with vaccines that may have been normal side effects or unexpected side effects. It's something that health providers use as a way to keep track of what's going on in the population as we're giving vaccines and learn more from them. So the data in VAERS that's reported out from the CDC is basically what people are reporting into it. So you garbage in, garbage out. If people are making good VAERS reports, in other words, they're founded, and it's not like, oh, my arm was red after, but real adverse events. And with anything that we do, any intervention that we do, there may be some people who have a stronger side effect than others, right? Some people may break out in life-threatening rashes when they take an antibiotic. Some people may have liver failure when they take Tylenol. So with every medical intervention that we do, there's always a small inherent risk. but the safety profile of vaccines, including these mRNA vaccines from the data we're gathering. And right now, worldwide, there's been over 2 billion, with a B, billion doses given of mRNA vaccines worldwide. So when you're talking about those kind of numbers, if there were any true safety concerns, we would be seeing some signal data by now, some concerns about safety. What the CDC also did, which was really smart, and I hope they do this in the future with all new vaccines, is introduce something called vSafe. So vSafe is a more active reporting system on how you're feeling after the vaccines. After you get the vaccine, depending on where you go, there's a QR code or instructions on how to enroll. And vSafe will send you a text every day for about 10, 14 days after each of your doses and ask how you're feeling. And they're collecting data on how people are doing after. One of the great things they're also doing is in all women of pregnant or childbearing age, they're asking about every 4 to 6 weeks after the vaccine, have you gotten pregnant? And if you're pregnant when you get the vaccine, they're tracking that as well. So vSafe has actually made this really, really, really robust database of tracking everyone after they get vaccinated. And that's where some of the early safety data has come out on pregnancy, showing that it has produced immunity in the babies, and they're doing great.
And if you are asymptomatic with COVID-19 and not vaccinated, does it replicate in your tissues?
Yeah, so the way any virus replicates or transmits is by infecting you and making copies of itself. So when a virus finds its way into your respiratory tract, your nose, your throat, it makes itself at home, starts making copies of itself. And as it makes more and more copies, you become more and more contagious to other people. So if someone is unvaccinated, it is likely that COVID's gonna take root and start to replicate. And Dr. Addison, do you have any further thoughts on that?
I think one of the early surprises was that people who were infected with COVID and were asymptomatic could still transmit the disease. I mean, clearly, if you're coughing and sneezing and producing all sorts of microorganisms, you can see how that could be contagious. But if you have no symptoms and just wandering around in a small room with a bunch of other healthy people who are not vaccinated, just breathing out these little virus particles can infect a substantial proportion. And that was sort of discovered in these outbreaks in the Navy, where they had this carrier where they had a bunch of people who were feeling fine, but all got infected. A lot of them got infected from asymptomatic people. So that's another reason you should get vaccinated. If you're vaccinated, you don't have to worry about being exposed to asymptomatic people. You're going to be safe.
Are there any long-term studies on the vaccines? Have you read any studies on the?
Well, I think one of the, the vaccines have been used in clinical trials since probably about 18 months, 20 months ago. So that's the longest, honestly, that's the longest term that we have. We do know that mRNA vaccinations have been given to cancer patients to try to fight cancer, for several years before they were used to produce vaccines for COVID. And one of the questions that still comes up with COVID is how durable are these vaccines? How long will this immunity last? And everything I read is the further we get away from those first shots that were given during the clinical trials, the better it looks. It looks like the immunity is fairly robust. Sorry.
Yeah, and I would just second what Dr. Addison said. The first participants in the very first phase of the first trials of COVID vaccines, the mRNA concept was built on decades of science on vaccines that had already been used to treat cancer patients, personalized mRNA vaccines. So this idea has existed for at least a decade. It's just there was never that push to use it in an infectious disease setting until now. And this was really just the perfect opportunity to introduce an mRNA vaccine into an infectious disease application rather than a cancer application, because it can be produced quickly compared to other vaccines. Some of the vaccines that we use have to be grown in cultures, or they have a little bit lengthier production process. And this type of vaccine can be produced relatively quickly, which made it an ideal candidate to get, fast tracked to make produce it a little bit faster, even while it was in trials, so that if it proved to be efficacious, which it did, if it proved to be safe, which it has, there was a supply on hand.
Okay, so I want to give you guys a chance to maybe respond to some of the questions that were sent to you in advance. Are there any ones that you wanted to you'd like to address?
Yeah, so the question, are there side effects from getting a COVID-19 vaccine? And the answer to that is it depends on the person. The most common side effect is having a sore arm, kind of similar to after your tetanus shot, that your muscle in that area is sore for a couple of days after, especially with the first vaccine. Some people can feel a little fatigued. Fever is common. You can have some chills or body aches, and all of those people who have those side effects, the reason you're getting those side effects is that your immune system has just been told, like, hey, wake up, I have something to show you, I have something to teach you. So your immune cells are going over to check out the vaccine. They're releasing the same chemicals that they normally would when they're trying to fight something off. So cytokines and things that kind of make you feel junky, because that's our normal immune response to something. So it is normal and even expected to have fever or feel a little junky the day or two after a vaccine. It's kind of a side effect of how your immune system is working and learning this. It doesn't mean if you didn't have any side effects to worry. It was likely still efficacious. Everyone is very different in their side effects. Some people can get a little bit of like redness and swelling a little bit downstream of the area too, and that can come up 3 to 5 days after, and that's also a localized sort of effect of your immune system learning the vaccine. But those are the most common side effects.
And a question here from Rich, what are the vaccines made from exactly? Or I guess, what are the active ingredients in the vaccines?
Yeah, so the active ingredient in mRNA vaccines is the mRNA itself. mRNA is a communicator snippet of genetic material that all of our cells use mRNA to communicate to the little ribosomes. Ribosomes are like protein building factories that live in our cells. mRNA is what gives the ribosomes instructions on what proteins to make. So what's inside of these vaccines is a little snippet of mRNA that tells our ribosomes, hey, make this spike protein. So we make the spike protein. The ribosome doesn't care if the mRNA came from inside of our nucleus or outside of the nucleus. In this case, it's coming from outside. So the mRNA never goes in our nucleus, never touches our own DNA. I know there's some concerns about these vaccines affecting our DNA, but there's just no biologic or physiologic way for that to happen. So the mRNA comes in, ribosomes make the spike protein gets sent out to our immune system. And the immune system learns it and learns how to make antibodies against it and how to recruit other cells like T cells and B cells and all of the little parts of our immune system that together are able to fight things off. So mRNA really is the active ingredient in mRNA vaccines. They have a few other things in them to protect the mRNA, so they have time to get into our immune cells near our muscles where they need to go so they don't break down. And it's like a little lipid envelope. So it's cholesterol and a couple of different types of fat that kind of protect the mRNA in a little bubble. And then there's some sugars and some salts in there too. There's no preservatives. As you would naturally think of preservatives, if it's salt and sugar that's in there. The Johnson & Johnson vaccine works a little bit differently. It uses a adenovirus, which is a cold virus to most of us. We would never know we had it. It feels like a cold. But they took out the guts of this cold virus and they introduced instructions on how to make the spike protein into it. And they made this virus unable to replicate itself. So you don't get sick from it. It's just that the virus does what a virus would normally do and delivers instructions on how to replicate itself. And in this case, it replicates the spike protein. So it's kind of a similar concept to the mRNA, but a different way to get to where you're going. So hopefully that answered the questions about the actives.
Okay, and if someone is pregnant, is it safe to get a COVID-19 vaccine?
Yeah, so a lot of pregnant women have decided to get vaccinated against COVID. I think for each woman, it's going to be a personal decision and something to talk over with their OB. But I have colleagues, friends who work in healthcare with me, and they had seen pregnant women die of COVID, especially during the early months. Pregnant women are at higher risk of complications and death from COVID. And so getting the vaccine may very well outweigh any risk. And the women who have been vaccinated delivered no complications. They're tracking the data on this. So the short answer is yes, the data shows that it is safe for women who are pregnant and lactating to get the vaccine. But of course, for each woman, that's going to be a personal decision to talk over with their OB-GYN.
Another question from Rich. Do the vaccines work on the variants, such as the Delta variant?
Yeah, so Dr. Addison, do you want to take that one first?
Yeah, it seems like it does from everything we can read. The Delta variant appears to be more infectious and a little bit more toxic to the human, makes you a little sicker. And most of the infections that are occurring in unvaccinated people. We have a lot of data again now, since we've had a lot of people vaccinated, particularly in the state of California, that most of the illness is occurring, even with the Delta virus, only in unvaccinated people.
Yeah, there were a couple of studies out from the UK. I think the UK was hit with their own variant first, that then came over here, and then they got hit with the Delta variant. And what their data is showing for the Delta variant is those that are vaccinated, fully vaccinated with 2 doses of the mRNA vaccines, they are protected against illness from the Delta variant. Those who only got 1 dose, though, may still be susceptible for it. So it's kind of a compelling argument to finish the series once you've started it.
And I think, correct me if I'm wrong, a lot of the vaccine in England was the Oxford vaccine, which is not an mRNA vaccine, but a adenoviral vector. Is that right?
Yeah, I think they did about half mRNA, half the adeno, the Oxford, AstraZeneca that they did enjoy. Yeah, there's a pretty fascinating website called Our World in Data, and you can see each of the countries' vaccine rates and the proportion of which vaccines they've used. And if anyone is curious, go on it and kind of see where the US stands in comparison with the rest of the world. We're actually really doing well in our rollout. I mean, places like Japan have only gotten to about 20% of their population vaccinated. I have family in Germany, they're only about 20% vaccinated. So the US now, we're up close to 60%. Here in Alameda County, we're over 80% now, which is kind of amazing. So yeah, it's a good place to live right now.
And if someone has an underlying condition, can that person get a COVID-19 vaccine? And like allergies or high blood pressure or whatnot?
Yes, unequivocally, yes. The only absolute contraindication to getting a COVID vaccine is if you've had a allergic reaction to another COVID vaccine. So in other words, if you had an allergic reaction to the first vaccine, most vaccine sites will not give you the second. You would want to talk to your doctor and allergist to talk about the risks and the benefits. But anyone with any underlying chronic conditions, so diabetes, high blood pressure, asthma, anyone with allergies, just normal run-of-the-mill seasonal allergies or even food allergies, we still highly recommend everyone get vaccinated. When you go to the vaccine site, there's a questionnaire that screens for all of the allergies that might be a cross reaction or a contraindication. So we really try to capture those people and make sure that we know if someone needs to stay for 30 minutes for observation after. Most people are only 15 minutes after. But some people might be 30 minutes if they have a history of anaphylaxis. So that's a life-threatening allergy to something like peanuts or tree nuts or a medication. But all vaccine sites have medications on hand and staff who know how to use those life-saving medications. So you can feel safe that if you go get the vaccine, people are going to know what to do in case of a reaction. And the allergic reaction is turning out to be very, very rare. When it first started coming out, it seemed like it was a little more prevalent among the healthcare folks, but as more doses are given, it's more like 1 in a million or more that the allergic reactions are occurring.
Yeah, I would say that if you have any of the underlying conditions that everybody talks about, obesity, hypertension, diabetes, you're the prime candidate. You want to get that vaccine. You don't want to take a chance, getting COVID, because even people who are in their 30s and 40s get really sick sometimes from this illness. And if you don't get terribly sick, you might end up sort of like a lot of people with brain fog and things that last longer than the acute illness. So you don't want to get this disease. This is not a common cold.
And a question from Rich. Is it possible to get the vaccine twice? And does it make it more effective if you kind of take one vaccine and then another vaccine?
Yeah, so
Interesting.
it's a good question. But right now it is not a recommended use of the vaccine, especially because it is a relatively finite resource. We want to make sure everyone gets the standard series first, which is 2 doses for Moderna and Pfizer or 1 dose for Johnson and Johnson. Now there's been a lot of talk and speculation, especially in the news, about booster doses, if that's going to be something down the line, especially if there are variants that it seems a booster dose might be a good idea for. And that question is still up in the air. The ACIP, the CDC's advisory panel of experts about vaccination, they have laid out all of the data that they want to see before making a decision about a booster. And right now, the study shows that the immunity with the vaccines is pretty long lasting. Those people who got vaccinated last year in the first studies are still immune. So nobody knows yet if we're going to need booster dose or not. But right now I'd recommend just sticking to the series and not getting revaccinated a second time.
And if someone can someone get vaccinated against COVID-19 while they are currently sick with COVID-19?
Yeah, so what the CDC recommends is waiting until you're out of isolation before you come and get vaccinated. And that's not necessarily out of concern for making you sicker, but more out of concern for not spreading it to people at the vaccine site. When anyone's diagnosed with COVID vaccine, they really should stick to those isolation guidelines, which is only leave your house for medical care. Otherwise, stay isolated, try to stay away from other people in your house who haven't contracted it. And then once you're out of isolation, you can go to a vaccine site and get vaccinated.
Here's a question from WW. How will they determine when boosters are needed? Will they wait till cases increase in the hospitals? Hopefully not.
No, so it's a good question without a really satisfying answer right now, because there's so many decision points and things they need to take into consideration in the background. The ACIP is watching not only the immune response of the people who were vaccinated in the early trials, but also the number of breakthrough infections that are happening in those who are fully vaccinated. So the vaccines, unfortunately, aren't 100% effective. Nothing in life is 100% effective, right? Not even our seatbelts. With every decision we make, there's always a little bit of risk in there. But this vaccine is near 95% effective in the mRNA. So that means there's still 5% of people, even though they're vaccinated, they may contract COVID, and they may be sick enough to be hospitalized. So they're certainly watching those breakthrough infections, and they're sequencing as many as they can. California right now is doing a good job of sequencing what variants are out there and getting circulated, so we know what percentage of what's going around is the Delta variant or the Alpha variant or our own homegrown California variant. So they'll be taking that into consideration. Moderna and Pfizer are already working on boosters that they have in trial in case it is needed, but again, it's still in trial. And a lot of different countries, the US included, are doing studies on swapping around things. What happens if you give Johnson & Johnson first and an mRNA vaccine as a second dose? So there's still studies going on to kind of find out what the most effective course is and how we can continue to have a fluid and a robust response to COVID if, unfortunately, cases start to go up again.
Another question from Rich. If I already recovered from COVID-19, do I still need to get vaccinated?
Yeah, I'll let Dr. Addison answer that one.
Yeah, it's recommended because, we're not sure how robust the immunity is after a natural infection. So I think the CDC recommends that even though you've been infected, you should get it. And we certainly have seen in the vaccine clinics that I've been working, there are a number of people who've come by to get vaccinated. And some interesting tales about what COVID was like for these poor people.
Yeah,
And oh yeah, go ahead, doctor.
no, go ahead, Paul.
Yeah, after you got vaccinated, do you recommend traveling, like getting on a plane, basically? And yeah, is it because I know a lot of people are eager to travel now and go to another state or another country?
Yeah, so the best, most cautious course is to wait 2 weeks after your second dose if you got Moderna or Pfizer, or wait until 2 weeks after Johnson & Johnson before you travel, because that's when you're considered fully immunized. In other words, the vaccine has had a chance to make enough antibodies in your system that you've got what's considered to be immunity against COVID as much as you can with these vaccines. So following all of the state and federal guidelines too, I know most public transportations now are still requiring masks. So when you travel on the airplane and a train, still masking up, when you're in common areas, and following the guidelines. But absolutely, people should get out and travel after they're vaccinated. I think the vaccine is the most powerful tool we have to getting back to how we used to live our lives, to get rid of these restrictions. And we may still see masks for a while, optional or not. I have no shame in wearing my mask still inside of grocery stores, even though I'm fully vaccinated. My kids have to wear masks because they're not vaccinated. I wear a mask with them in solidarity. So each person can make their own decision about the masking indoors. But this vaccine is our ticket back to somewhat normal life again.
Okay, well, our time is almost up, but I just wanted to ask our panelists, what would you say to someone who's hesitant to get vaccinated, the COVID vaccine? COVID to get vaccinated against COVID, what will be the number one reason why, the number one benefit to getting vaccinated?
Well, I would say there's two reasons to get vaccinated. The first that I said several times, this is not a fun disease to get. And even if you're only 35 years old and you think you're robust immune system, blah, 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 people have died who are 35 years old. More likely, though, is that you will have lingering symptoms. You don't want that stuff. But the other reason to get vaccinated is just that it's important for us as a society to essentially do everything we can to stamp out this virus. And as long as there are susceptible people, the virus will be with us. So the more people that we have vaccinated, the more likely it is that we can, travel with impunity and do other things. Now, obviously, it's a worldwide pandemic. So just vaccinating America is not going to cure the situation. And we do need to make sure that all continents get vaccines and get effective vaccines, not ones that are not effective. And hopefully we will do that. But you got to do your share to fight this thing. It's a social obligation.
Yeah, and I would second what Dr. Addison said. I think the most important reason to get vaccinated is to do our part to protect the most vulnerable among us. It's kind of that unspoken societal contract. We look out for each other. I think it's important to remember that there are people who can't get the vaccine for some reason, or right now are too young to get the vaccine, or might have an immunocompromised condition and the vaccine wouldn't work as well in them as it would in other people. So for the majority of us who have no problem with the vaccine, very few side effects after, and it's incredibly efficacious, we're doing our part to stop COVID in its tracks and start to get things back on the road, to just having normal lives and not worrying about it as much. But I would say for anyone who's hesitant, it's okay and it's normal and it's understandable to have questions about this, especially if you're thinking about vaccinating your kids 12 and up. It's normal to have questions. Reach out to your healthcare provider, talk to your pediatrician, talk to your family practice doc, talk to people who have taken the vaccine, talk about their experience with it. And most importantly, be sure you're getting your information from reliable sources. There are, unfortunately, people out there who would put out misinformation, incorrect statements, try to mislead people or stoke fear, and it's just not well-founded. So I would stay away from anything. Don't get your vaccine information from Facebook, but go to the CDC's website, go to California Department of Public Health or Alameda County Public Health Department's website, and you can get a lot of good facts from there.
Again, I want to ask, can anyone get the vaccines from Access Community Health? They don't need are there any requirements to using that service?
None at all. For anyone between 12 and 17, you do need parental consent. So if a parent's not able to come along with them, they can sign a letter in advance, or you can pick up the consent form and sign it, or we can get verbal consent. But anyone can stop by. 12 and up, we've got Pfizer. And if you have an ID, great. We can still work around it if you don't have an ID. I know a lot of students sometimes bring their high school or their junior high ID, but we can work around it.
Okay. Wow, that went by really quick. It's almost 7:30. Unless there are any other final questions from our panelists, we will call it a night. I want to thank Dr. Dawnell Moody again and Dr. Thomas Addison for taking their time and energy to join us this evening to respond to so many questions. And I thank you. On behalf of the library and our community, I thank you both.
You're welcome.
It's been an informative program.
My pleasure.
Likewise.
Thank
so
you
much,
to
Paul.
our attendees. And again, have a good evening.
Thank you.
Stay safe, everyone.